Imagine being assessed a 70% late penalty for Medicare Part B simply because you didn't know when you were supposed to sign up. Hi, I'm Danielle Roberts, co-founder here at Boomer Benefits, and over the course of the last 15 years working in the Medicare insurance industry, I've seen penalties this high happen many times. Sometimes these penalties can add up to thousands of dollars of wasted money over your lifetime, so I'll share with you some best practices for avoiding these penalties altogether. Most people first become eligible for Medicare upon their 65th birthday, although some can enroll in Medicare earlier if they have a qualifying disability or suffer from Lou Gehrig's disease or end-stage renal disease. Your initial enrollment period begins 3 months before the month of your 65th birthday. It goes through your birthday month, and then it extends for 3 months after for a total of a 7-month window. For example, if you turn 65 in June, your initial enrollment period will go from March 1st until September 30th. This gives you plenty of time to sign up for Medicare on time. Unfortunately, you'll pay more if you don't enroll when you're first eligible. If you or your spouse have a qualifying work history of at least 10 years, 40 quarters, then you likely paid FICA taxes during those working years. This makes you eligible for premium-free Part A if you did. You pay nothing for Part A, and you won't incur a penalty even if you sign up late. However, if you are one of the 1% of people who don't have the necessary work history, then you would pay for Part A and you need to sign up on time to avoid a penalty. So again, if you're not eligible for premium-free Part A, you need to sign up during your initial enrollment period. If you don't, you could face a 10% premium penalty for twice the number of years you could have had coverage but didn't enroll. For example, if you were first eligible for Part A in 2017, but didn't enroll until 2019, you would pay the 10% premium penalty for 4 years. It can add up quickly because Part A is expensive. In 2020, people with 30 to 39 quarters of qualifying work history pay $252 a month, and for people with fewer than 30 quarters, it's $458 a month. If you had to pay the maximum penalty for just 4 years, you'd lose over $2,000. Since most people are eligible for premium-free Part A and therefore don't incur the late penalty, we don't see that one happen all that often. It's far more often that we see people get assessed a Part B late enrollment penalty, and this penalty is imposed for the life of your Medicare coverage, which is usually for the life of you. The Centers for Medicare and Medicaid Services set the standard Part B premium each year. Most people pay the base rate, which is $144.60 a month in 2020. Some people with higher incomes are subject to the Income-Related Monthly Adjustment Amount, or IRMA. You can find this chart on our Medicare cost page to determine what you will pay if you have a higher income. You can also find a link to that page in the description below the video. If you don't sign up for Part B during your 7-month initial enrollment period for Medicare, you may be subject to a 10% cumulative Medicare Part B late penalty. This penalty is imposed for each 12-month period that you delay enrolling in Part B when you're eligible to enroll and don't have other creditable coverage. In other words, if you put off enrollment for 3 years, your penalty would result in a 30% higher Part B premium. You would have to pay that additional amount for as long as you have Medicare coverage. It's easy to see how quickly this can add up to thousands of dollars. The premium penalty is based on each year's standard Part B premium. So every year that there is a premium increase on Part B, your Medicare Part B late enrollment penalty will also increase since it's tied to the standard premium. Here's how it looks in real life. If you're just signing up this year after delaying enrollment for 3 years, your penalty would be more than $40 a month for as long as you're covered by Medicare. Plus, it will go up every time the standard Part B premium goes up. Sometimes people ask us whether getting a late enrollment penalty will affect their eligibility to enroll in Medicare supplements. Fortunately, the answer is no. You have 6 months from your Part B effective date to enroll in a Medicare supplement with no health questions asked, whether you have a Part B penalty or not. Now, there is a common exception to the late enrollment penalty for Part A and Part B. Let's take a look. You can delay enrollment into Part A and B if you have qualifying health insurance coverage from another source. Most of the time, this would be a large employer group health plan. In this scenario, the employer plan is primary and the Medicare is secondary. Many people who work past age 65 also delay Part B until they retire so that they don't have to pay for Part B while they're still working. However, if you qualify for premium-free Part A and you don't contribute to a health savings account, then you can go ahead and add that on at 65 to at least have the extra hospital benefits. Be aware, though, that for small employers with less than 20 employees, the rules are different. Medicare is primary in that scenario, so you need to enroll in both Part A and Part B during your initial enrollment period. Over the years, I have met dozens and dozens of people who didn't know this and failed to enroll in Part B on time. They are unaware that they are accumulating a penalty, and years later when they go down to Social Security to enroll in Part B, they get a nasty surprise. Don't let this be you. And now on to the late enrollment penalty that most beneficiaries find to be the most annoying penalty of all. Although enrollment in Medicare Part D coverage for prescription drugs is considered voluntary, you will still incur a Medicare Part D late enrollment penalty if you don't enroll in a Medicare prescription drug plan during your initial enrollment period and you had no other creditable drug coverage. As with Part B, the Part D late enrollment penalty is based on the amount of time you were without coverage. Once you finally do enroll, the penalty applies for as long as you are enrolled in a Part D plan in the future. The Medicare Part D penalty is 1% for each month you went without prescription drug coverage, rounded to the nearest 10 cents. So if the national base Part D premium is around $35 a month, and you were without creditable prescription drug coverage for 26 months, for example, your premium would be nearly $10 higher than the national base. This late enrollment penalty is added to the current monthly premium that you pay for your chosen drug plan. Since the premium penalty is pegged to the national base Part D premium set each year by CMS, it will go up every time the Part D premium increases. For more details on how Medicare calculates your Part D late enrollment penalty, visit the Medicare.gov link in the description below. This is why it's a mistake to pass on prescription drug coverage as soon as you're eligible. Even if you don't take many prescription medications right now, enrolling in a drug plan eliminates a future penalty that would stick with you forever. More importantly, you can only enroll in Part D during certain times of the year, like the fall annual election period. If you skip Part D up front and then develop a serious illness requiring expensive medication later on, you could end up paying full price for that medication all year while you wait for the next election period to come around. We have seen this a number of times where someone develops cancer and is prescribed oral chemotherapy medications. They can end up paying tens of thousands of dollars out of pocket while they wait to get into a Part D drug plan. Now, let's look at some exceptions to the Part D penalty. If you qualify for the Medicare Extra Help program, you will not have to pay a late penalty. The Extra Help subsidizes the cost of Part D prescription drug coverage for low-income individuals. It also eliminates any penalty even if you've gone without creditable coverage for more than 63 days. Also, you can delay Part D without penalty if you have drug coverage through an active employer past age 65. However, keep this in mind, you are responsible for later proving that you had creditable coverage from a former employer. That means saving the letter of creditable coverage that your employer group health insurance company sends to you after you quit your job. This letter should arrive within 2 weeks of the last day of your coverage. This is not something that your Medicare insurance agent can help you produce later on. So you must be diligent about saving evidence of that creditable coverage. When you finally retire and you enroll in Part D, you will have to prove to your new Part D carrier that you had creditable coverage for all of the months since you turned 65. And that proof of coverage letter is your ticket to having that penalty waived. You can also avoid the late enrollment penalty for Part D with creditable prescription drug coverage through other sources such as VA drug coverage or Indian tribal drug benefits. Many people end up paying a Medicare late enrollment penalty because they just didn't know the rules. You may be healthy at age 65 and you feel you don't need Parts A or B or D. The penalties for such a mistake can add up to a great deal of money over time. Consult with a Medicare insurance broker like Boomer Benefits to ensure that you enroll in coverage when you are supposed to and minimize risk of penalties. Our service is free and we are happy to help you. Now that you've learned a bit about penalties, you might be curious to know what other Medicare costs are out there lurking around. Check out our Medicare cost video to get the scoop. Also, don't forget to subscribe for a new Medicare video every other Friday. Thanks for watching and have a great day.